tell me a little bit about grains. What's the origin story?
Yeah, the origin story is around greens made with love by clothing technology. So, greens is a product of explosion technology, and the green name came from my dad. He was diagnosed with type 2 diabetes three 3 years ago. Now it's 4 years ago during the pandemic. And during this time at the pandemic, he gained some weight, 15 to 20 pounds. He was very isolated. And he was referred to his local nutritionist. And during this time with the nutritionist, she said, "Hey, if you really want to solve for this diabetes thing that you're managing, you should eat more kale." My dad looked at her and he said, "What the hell is a kale?" Now, I'm being funny, but I'm being serious. So I'm funny serious
Yeah,
because that's when he realized that and I realized that there is a cultural relevance gap in
yeah,
suggestions when we talk about diabetes and nutrition management. And so once we had a conversation about it as a family, he came home and we realized doing some nutrition literacy ourselves on Dr. Google and Dr. WebMD. What she could have also said that was relevant is, hey, you should consider eating more greens because it
yeah.
also has high fiber, high protein, and that can help slow down your blood sugar when you combine that with other meals you may be eating that are high in carbs. And and so from there, that's the origin story on one of the insights that that we had when starting greens.
I think that's a huge. I mean, I know you and I have talked about in the past, but cultural relevancy is so important for. I mean, it's mishad conversation, just like you're saying with your dad and God, my father too. Like, not exactly in the same way, but if you're not talking to people in a way, you have to meet people where they're at. Otherwise, there's no point in meeting, right?
Yeah.
And no, I think that's a really great story. What so is it because of your dad's experience that's why you focus on diabetes?
Yeah, it's a combination of things. So impactfully, it came from my dad's story, but also previous work experience of building technology. This is the third startup company I've been a part of, and I want to do something impactful with this company. We're about 3-year-old, 2 3-year-old company, and so I've had the ability of building digital health applications and wearable technology, but it was never something that I felt I can get behind on an impact level. It was mostly motivated by the scale of the market or the venture capitalists that I knew or the new trend. And so, I saw what I did there. Now, there are some diabetes technology trends where it was only for type 1s and now it's translating over type 2s. And it's just growing rapidly that I feel like I can be a part of and improve, but also just the amount of family members that I have who are managing diabetes. Um, it was something that I wanted to I'm already trying to help them. Every time I see them, I give them
Right.
feedback on their diet, and so this is something I saw now could be good for my family, but the community and the world.
So I was doing some research last night, getting kind of prepared for our discussion, and National Institute of Mental Health says that people with diabetes, teens with diabetes specifically,
Yeah,
are about twice as likely as their peers without diabetes to have some of the major psychological issues, especially those around eating, like
yeah.
bulimia. So, how important is it to address diabetes distress when you're trying to make behavioral changes?
No, yeah. One of the terms that we talked about a lot Neil, prior to this call, we can bring it up on this call, is motivational interviewing.
Yeah.
And so that is something that I believe you don't necessarily have to be the top psychologist to really apply to your situation as someone who who may not be a practitioner, who may not be a nurse provider, who may just be a parent, right? And so I think distress is a huge one because distress is a key lead indicator to depression or
Yeah.
high anxiety, and depression is a key lead indicator to suicide. And so diabetes distress, it also can stop someone from actually managing their diabetes. I met so many um, so many folks where they are have so much distress that cognitive load is can't manage anymore, or they can't make another decision, so they give up on the whole process of checking blood sugars, taking insulin. And so, especially when you're a young adult or a teenager and you're going through school, so you're worrying about what other people think about you. So the
Yeah.
judgment is all time high. I feel like there's research to show your brain hasn't fully developed
Yeah.
cognitively to 25.
Sure.
So you're influenced by people who don't even have your best interests at heart, which is friends or a boy or girl, them or they that you like. And, you just it just leads to poor decision making when it comes down to it. And so I believe that motivational interviewing, one of the cues is, especially when talking to a team, is you let others. Um, it's two frameworks. I remember you want to soften, sustain talk, but you want to empower change talk. So sustain is, this is too hard for me. I can't manage this at school. People are going to make fun of me if I'm checking my blood sugar, giving myself insulin, or looking at my pump. People don't like this thing popping out of my arm, and so you kind of want to soften that. Don't you acknowledge it, but you don't make that the whole conversation you're having with this person. And every once in a while, you can get some change talk and says like, well, it sounds like you may not like feeling this way after you don't take your insulin, or you haven't checked your blood sugar, or you haven't taken a walk after class. And then the team may say something. This way you want to empower change talk. They say, yeah, I do feel better when I take a walk, after eating, or I do feel better if I take my insulin after this situation. And so that's a very minute situation, generically speaking. But once you said the distress, I was just thinking of motivational interviewing as one solution that it
Absolutely.
requires a little bit of another person. It's not just by them, self,
But I think that one of the things that I like most about motivational interviewing is respecting the things that you've done. Well, I mean, respecting the things that other person's done, right? So, like, I've, I don't know if I'll include this in anything, but I have been that person for sure, no doubt. Like, you just feel so stressed out, you're completely ineffective, and I don't honestly. I think the numbers when it comes to diabetes distress are way too low. I don't buy it. I think
oh,
it's high because if you talk to people about distress, everybody is right. I mean, not to the degree of not taking care of themselves, but it's easy to fall into that. And just telling somebody, take a look at what you've done. I mean, you've managed even if you haven't aggressively managed, you've lived through this disease for a long time. And that is something to celebrate. And now, maybe just like you're saying, then, kind of evolve into the change conversation. But I do think that, especially with teens, some of that reinforcing talk is very good.
man, yeah, feeling empowered, feeling like you can do it. But the distressing thing you said, what I don't know exactly what the numbers are, but I'm assuming it's in the teens or
Something like that. So it, it was
20%.
it was like in the 20s, and I'm like, bullshit, that's off by like 80%.
You
But
know,
okay.
what was the approach to doing that? How many people are not even going through the distress survey, right? To
I don't
even
know.
get
That's a good question. I'm actually going to interview Bill Plonsky also, who
okay,
is he created that survey.
okay,
That's a really good question. I think that honestly, they're probably in reality talking about exactly the case that you mentioned. Somebody is so stressed out, they're they're mentally blocked from taking care of themselves, and that might be an anomaly. I'm just guessing that if you ask, like in their lifetime,
mm-hmm,
people with type 1,
mm-hmm,
have you ever felt like this? I'm guessing it would be over 80. I mean, people get stressed, and and there's complications, and there's so many things. It reminds me of a book that I read a long time ago in college, and it was about train. I might have told you this before. It was about training surgeons, right?
mm,
And it's the best surgery makes dead patients, right? Like
mm,
it's just there's human factors that you can't control,
yeah,
and that's the same thing with managing a chronic disease, and that can be really really overwhelming. So
interesting.
I I'm all for. I'm a big fan of motivational interviewing. So tell me more about how coaching, how you guys use coaching to effectively.
Yeah, yeah. It's been an area that we're starting to adapt. Our first couple of pilot programs were with a actual diabetic ketoacidosis outpatient clinic. Diabetic ketoacidosis is when someone blood sugar has been above 300 milligrams per deciliter, or just very freaking high,
Yeah,
for an extended period of time. So this is 1, 2, 3, 4 days straight, and it
yeah,
could cause some very dire symptoms such
yeah.
as passing out, nausea, and other things around using the restroom a lot. So, um, people may not even know they have DKA when they're going through it because it's hard to it's hard to be aware of it if you're the person going through DK. And Neil, you probably can tell better stories than I can tell about that.
Did I tell you the story about the nurse? What
Yeah,
happened?
yeah,
Okay, so yeah, I mean, I think that people, yeah, I especially if you don't know much about the disease, you definitely can get caught off guard. And I mean, if you don't take a Lantus shot one day, or if your pump doesn't work, I mean, yeah, DKA is awful, but it so okay, so DKA, that's the scenario. So how did you go ahead?
so one part of what we're doing on a very simplistic side is a digital health first application where the person gets reminders if we or daily reminders to take their insulin, long acting insulin, Lantus, right? And
Yeah, that's what I'm
also another
interested
part of DK, some people that we work with may have to miss a day of insulin just because they can't afford it. So it's been aware of what you're eating, right? Being aware you may that day you don't have any insulin, need to be extremely aware of going low carb or exercise. And so we made a photo-based carb food journaling application to remove the barriers around understanding what meals spike you and cause you to have high blood sugars for a long period of time, right? So sometimes you have to be situational on, maybe I can't take my insulin. I gotta figure out how to last another 7 days so I can get my prescription renewed. Which in that DK clinic was a higher probability because 90% of the patients that we work with were on Medicaid. So Medicaid is when you're at a certain amount, uh, you're very close to the poverty level. Now you may be 30, 50% above poverty level, which in America there's more state-based or city-based, could be $40,000, right,
Yeah,
to manage everything, or or $18 an hour. So when you have resource straps, the things we start to realize when we're going to the coaching has been the emphasis on having actual coaches help you navigate the system. And some people just need to realize once they get educated on the food and have the behavior of taking the insulin, or they may miss a day, the coaching has come into place where helping you navigate. Hey, if you ask your physician, Dr. Mary, is there any way I can get a discount on my Lantus for this month? Or here's a community-based organization where they have Lantus available, a local nonprofit. So you don't go 7 or 10 days without this insulin, and wind back up in the emergency room. So a lot of times people we learn people, it sounds simple, but it's a big deal. You just so many decisions you have to make. If there's a barrier with you and, going and calling and being on the call line for 30 minutes to try to figure this out, it's a deterrent of success. And so that's what we see in the coaching come into play. And it becomes really helpful. Like you said, or just someone to talk to as well about the issues that they're going through, and how difficult the process is.
Yeah, I know that sounds great. I think just one thing on that point, I think that there's way too little focus on how many people are, and probably this is because of drug. I mean, I'm not a conspiracy theorist, but I'm guessing that the reason why there's not a lot of discussion on rationing insulin is because drug companies don't want there to be a lot of discussion on that. But I mean, I have seen reports as high as 40% of people are killing themselves. So it's just nuts. But I mean, I think what you guys are doing is great, and I think that I think if you can have a coach that can help you find the resources you need, I mean, that's amazing. That's saving has, in my religion, Tikkun Olam is basically saving the world one person at a time. Which, I mean, if you can do that, that's a good thing, right?
Yeah.
So what about 5 months after that? Like, how do you ensure that person sticks with the program, or
Yeah, well, the goal we have is for people to graduate out of the program, and so which is great. And so a lot of times when you're in DKA, the program we have, like the metrics we have right now, part of this outpatient clinic, is that A1C goes from, like, the ranges of A1Cs and from in the 10 to 12s in this clinic. So we want the A1C. You don't have to be perfect 7. Just let's get you down to a 9.
Yeah.
Right, 8-ish range, something that's manageable. Teens also have the highest A1Cs when you're talking type 1s, just because it's you also start to manage things on your own, right? Your parents aren't there to stick you or recommend you. You're in high school, right? So that 9 to 8 range is good enough for a teen. The most important one is, after 5 months to a year, you're not going back 5 months to 12 months. You're not going back into the emergency room for DKA. That's the biggest measuring stick. So that means you've learned, how to eat a ration, how to work this, how to manage yourself, or be a part of the system, that you're not going back to the emergency room. And so those are the core goals of the program. But in terms of interesting business models, I think there are a ton of things where the coaching and education, the person can stick along the ride, and that can be through things like at-home monitoring or remote patient monitoring screening for the services. But that's what we see as the goal initially, and it'll probably scale from there in community-based programs or a network or something like that. But at this moment, success is based on keeping people out of the emergency room. Because when you're in DKA, this outpatient clinic, most of the patients are in and out of the emergency room, right? And so, huge opportunity to be very impactful, not only to the patient, but also to the health system and then in the insurance plan.
Yeah, definitely. I mean, at the end of the day, the only thing a lot of times, the only thing people will listen to is money. But luckily, in this case, there also happens to be a lot of money that can be rectified, if you will. What fact stands out to you as if you were to stand back and think about it, is the most surprising or most egregious or negative when it comes to diabetes?
I would say I really like what we're talking about in this stress area, but the up and coming thing I think is very interesting. I don't know if it's egregious, but it's something that is pro and con. Is the new GLP-1 or Ozempic or Mounjaro?
Yeah,
It's pros and cons to it, but will it be the insulin killer? I don't know. I think we gotta let 20 years go by.
yeah,
But is it beneficial? Is it beneficial? Currently, it's only in a small sample size now. They just went through FDA clearing. I think about GLP-5, right? Because insulin's been around for 30. We're on GLP-2. I'm just saying
okay,
GLP-5. I'm assuming every version they
sure,
will iterate over the next 10 to 20 years. We'll be getting more data. But I think there's just so many pros and cons to it, and the fact that it's such a hit. I think the egregiousness is how there's a short supply because it's also an obesity drug. However, I believe that's actually helping the diabetes market.
oh
That,
yeah,
that the demand for, obesity, when talking type 2 is a thing. And even in type 1, weight
sure,
management is a thing because insulin can really affect your freaking weight. Like, how do you lose weight and, how much
yeah,
you have inside of your body. It's unfortunate. But I was trying to read, I don't know if type 1s are approved for Ozempic yet. And depending on what health plan you have. But the egregious thing is right now, I don't know how safe it is, but I believe the obesity group, it's not really, it's just, I think it's a phenomenon where the cons is we don't know the effects of this system. We don't know how it's going to how it's going to affect people, but it's been adopted so quickly. So that's interesting. But I think there's a huge responsibility for us to take to do it responsibly, like we used insulin in the past, because the outcomes are very interesting. But I would say I would love to push people more on how do you use it, but taper off of it, right? To where it is not like insulin, it's not like a lifelong thing. But most of the situations I've seen is lifelong. You have to be on this GLP-2 or 3 drug because I haven't seen too many people who've done it and actually change their eating habits or change their lifestyle habits. And
that's very
behavior is so difficult, right? And what I learned about it is just, it's a meal suppressant, right? And I forget the exact technical term, but yeah, that's probably the
that
most
it's
interesting thing.
that's interesting. That is very interesting. I think you hit it. I mean, the number one thing probably to remember, and I have fallen into this a little bit myself, and I have relatives who have as well. You
Mhm.
have to remember that it's not a drug to make you eat right. It's a
Yeah,
drug that's going to make you eat less.
put
So
that in the highlight. It's not a drug that make you eat right, eat less. That's really well said. Well said. I wish I could have said that in the same amount of time you said that as well. That was in like 5 sentences.